So you say no more dentures. The future of dentistry will be no more dentures as
No
we know
more
them.
dentures flopping around in our mouth. That's the goal, because we have too many cool things in dentistry, better technologies, and dental implants are really revolutionizing what we can do with dentures. So my goal is I don't want any of my patients to have any of those dentures that are flopping around. Let me show you some options.
Okay.
These options, the first option is just to have 2 implants. So they're artificial roots that we place down in the bone. They heal up in a couple months.
So right here?
Usually right around the canine area, yep.
Okay.
And they heal up, and then once they heal up, we can attach a denture to it. So you can see on the inside of that, there's 2 little attachments.
Oh, yeah.
And then that snaps on. I want you to listen to this. Hear that snap on there?
Nice.
And then try and get that off.
Okay.
I mean, they do come off, but they're a lot more stable.
My hands are probably a little too greasy, I guess.
Yeah.
But
and those are
so they're
tight.
snug.
They're very snug. Now on that one, if we just use 2, that's a good option, but the downside to that is it's still not as stable as a lot of people
But no more
like.
adhesive with this option.
You shouldn't have to have any adhesive on this.
Is it painful, by the way?
It's not painful at all. My dad actually had a dental implant. He had a tooth extracted, and then he couldn't have it replaced right away. So then we got him a dental implant. When he went to have the dental implant surgery, he walked out of there the next 2-3 days. He says, the worst part about that was 5 years ago when I lost a tooth. That was way worse than this. The bone doesn't have nerves, and so it can heal up around that, and you ibuprofen, Tylenol, maybe some Vicodin. It's usually all you get. It's really
so no more dentures.
invasive.
Okay, so 2 implants, snap in, snap out.
And that's called a locator denture. Snap in, snap out, great. The next one option is a little bit better because it gives us more solid base to it, and where you start adding a couple more implants. So you have 4 implants, and then you place a bar across those implants. Now what that does is instead of allowing the denture to rotate back and forth on those front 2 like the last option, it now stabilizes the back teeth, so that when you're chewing, you're not getting any of that motion up and down.
Can you eat
whatever you
want?
That. You can eat almost anything that you want. Absolutely. Apples, carrots, things that you used to not be able to eat, you can now do. And especially on those back teeth, you can get that stable, and it snaps in and out. So the cool thing about that is you can take this in and out at night.
So you do the surgical part?
I have a wonderful oral surgeon that we work with. We have a good team. He does the implants parts, and then I'll do the restorative part.
Good.
So, yep. So that's the second option. That's a bar retained denture. Then the third option, which I'm really excited about, is that these teeth can actually stay in your mouth too. So if there are people out there that want to not take their teeth out at night, and I would be one of them. I wouldn't want my teeth out at night either.
Yeah.
We can get them to stay in, and so this is called a hybrid denture, and you can see on the back side there's some screws down in there, and only your dentist can take this out.
So you brush them,
so you
just
brush
like you would
them,
normally take
and you
care of
brush under the bridge, and it's all supported by implants, and so this never comes out. This is the most like your real teeth that you can possibly get.
So can a 75, 80, because that's very young, qualify for a fixed set of teeth?
Absolutely.
Like
yep. If they're healthy, anybody can have these. If you're young, teenager, 75, 100 plus. We did have one patient that did it in his mid 80s, and he was so glad that he did it.
What do they like most? Just the eating and the chewing?
Because they've been in dentures for a long time, and they've had to adjust their diet. They've had to adjust what they eat to eat softer foods. And now all of a sudden those dentures are staying in place, and they can chew harder foods, and they can taste it better. You can sometimes, even if you're going to do more implants, you can remove the denture off of the roof of the mouth. There's a lot of taste that happens from the roof of your mouth. And so if you have a denture covering it, food doesn't taste the same. And all the denture wearers out there, they know that. They're like, man, it just doesn't taste the same. And we can give them some of that back.